So I made us some cookies and some coffee for today.
Oh, that sounds delicious. Thanks for helping me out today, Aunt Maria. I know you're a health insurance expert, and as I said on the phone, this is my first time having health insurance on my own. So I'm a little confused about the information on my plan, and I really want to understand that better, as well as how much everything's going to cost me.
I'm really glad you called. I think I can help you better understand your plan and some of the costs associated with it. So what I thought we'd do today is take a look at those costs and the documents and estimate your total out-of-pocket costs and then how much you need to save each month so that you have it when you need it. Did you bring the documents I asked you to bring?
Yes, I brought the ones that I could find.
Oh, that's great. So sometimes healthcare costs can be really high, and so it is really important to kind of pay attention and track them and estimate your costs, especially because there'll be costs that are over and above the premium. So we'll talk a bit about that today and help you calculate those out. So the first thing to sort of think about is really, why that's important, why tracking is important and estimating is important. And it's really about keeping yourself out of trouble financially and to make sure that you have access to care that you need so that you stay well, right? So one of the things that we know is some people go into a lot of debt because they haven't planned for healthcare expenses. And so another reason to kind of keep track and understand them is to be sure that you don't use your credit card to pay for medical bills.
Right, yeah, I know my budget is tight, and I want to make sure that I start off right, and I also want to make sure that I can pay for the healthcare that I want and may need.
Perfect. One of the things I did was I brought this fact sheet that I think will be really helpful for us to go through, and it asks for information about some of those out-of-pocket costs. Let's start with your pay stub, right?
Okay.
Because that'll have some of the information that we need about the cost of the premiums.
From my pay stub, it tells me that I pay $150 for my health insurance premium per pay, so then that would be $300 per month. And then for my vision, I know that I pay $15 per month, and then I also have dental, and so for that I pay $15 per pay, which would be $30 per month. When I add that all together for the month, that would make my total cost be $345.
Right. So those are the fixed healthcare costs, the premiums, something you're going to pay every month to just have insurance.
Okay.
The next thing we need to think about is the annual deductible. And the annual deductible is an amount that you pay before health insurance starts covering costs. You can find information about the deductible in the evidence of coverage and benefits booklet that you got. We could look into look at the table of contents and kind of figure out where you can find that.
Okay. So then my deductible is $500. I picked a low amount because I don't have that much money saved up.
That's good thinking, to start out like that, because you don't have a lot of money saved up. But over time, you might be able to raise that deductible because there's like this balance between the deductible and the premium. And usually, like, the higher the deductible, the lower the premium, right? The lower the deductible, the higher the premium. So, okay, so $500 gets written down on this sheet.
Okay.
Great. Okay, and so then the next important thing is the out-of-pocket maximum. And the out-of-pocket maximum is part of the plan that says that once you reach that amount, the health insurance plan will cover all other expenses. So that's really helpful, like if something catastrophic happens or something terrible happens. That's another number to sort of pay attention to as you're trying to choose a plan. So again, let's look in the evidence of coverage booklet and figure out what that out-of-pocket maximum is.
Okay, so that would be $3,000.
Yeah, okay, so then you would put $3,000 there.
Okay.
That's great. You know, one of the things I forgot to tell you about the deductible is for a lot of the preventative services, they're covered without having to pay the deductible first. So like your annual checkups to your primary care or your GYN, that would be covered and you wouldn't have to pay the deductible first. So that's really
Okay.
important. It helps us keep healthy,
Yeah.
right? By going to the doctor and getting our those physicals done every year.
Yeah, that's good to
So,
know.
Yeah, important. Okay, so that's great. So the next thing is really to think about the flexible expenses that happen over time. And that really has to do with how many times you go to the doctor, like who you go to, how many times, and then what is typically paid at that time is something called a copayment, right? And so a copayment is usually a fixed amount that you pay at the time of service, and the information about where those costs are can usually be found on either your insurance card or also this evidence of coverage and benefits. So insurance card's probably the easiest
Yeah,
place to
I have
find
that
it.
right
Oh, awesome.
here.
Okay, so on here is the co-payments for the different kinds of doctor's visits or whatever. So how many times, you could think back last year, how many times did you go to the doctor last year?
Well, so I know that I went to go see my family doctor once for my annual checkup, and then I also went to see her twice more for allergies. And then I also went to my eye doctor once, and then I saw my gynecologist once.
Okay. What you want to do then on this worksheet is you'll see that there's places for regular doctor, specialist visits, eye exams, dental visits, things like that. And so you put in the number of times you visited and then what that copayment amount is, and then you just do the little multiplication and then we add it up. So why don't you take a stab at that and
Okay.
I'll help you.
Okay, so from my insurance card, my family doctor visits have a copayment of $25, and then my specialists have a copayment of $30.
Okay. So
So-
right here is the one for your office visit.
Okay, so I went once and then twice for allergies, so that's 3 times, and then the copayment amount was $25. And then I saw 2 specialists, and then that's $30. The 3 times 25 would be 75, and then 2 times 30 is 60.
Perfect. Great. And how about glasses?
Oh, glasses, yes. I also did pay $150 for my glasses last
So
year.
there's a place to put that in there too. So let's see, vision products, right? So you can put your $150.
Okay.
One of the other things that you can include are kind of medical expenses that you have that are not covered by insurance. And so there's a spot right here for other, it's called non-qualified healthcare expenses. Do you have an idea of what those might be?
Well, like I said, I went to the doctor a couple times for allergies, and I know I did pay $30 for allergy medicine, so I can put that in there.
That in there. Okay, so if we add it up, then it comes to
$315.
$315. All right, that's great. One of the other things that I need to tell you about is another different kind of cost is called coinsurance. And coinsurance is another cost share aspect of health insurance, and it relates to the cost of certain procedures or activities that you do as you get services. And it's always calculated as a percentage of the cost of whatever that thing is.
Okay.
Again, in your evidence of coverage and benefits, it will tell you what procedures, right, and what that coinsurance might be.
Okay. So you mean if I have to have surgery or something?
Surgery or physical therapy or, those kinds of hospitalization, usually there's a percentage that you would pay. And the way it's sort of listed in this book is usually how much the health insurance will cover. And so if it says 100%, they cover, then you really don't have an expense. But if it says 90% covered, then that means you have a responsibility for 10% of whatever that cost is.
Okay.
Very hard to estimate though, because we don't know how much things cost. So a lot of times what people do is ask their physician or the hospital or whatever, how much is this going to cost me, and then compare it with how much their coinsurance might be.
Okay.
The next thing to do is really to figure out your monthly amount, how much you need to set aside every month.
Right.
So on box 1 of this worksheet, it kind of talks you through that and then asks you to put in the amount, annual deductible, as well as that total flexible healthcare cost that we just calculate. So
Okay.
I'll let you do that.
Okay, so my annual deductible was the $500, and then my total flexible healthcare cost was the $315.
Right.
So
Add
then
that together.
that is $815.
And if we divide that by 12, it gives you the amount you need to set aside every month.
Okay, so when I do that, so I do the $815 divided by 12, that gives me about $68 per month.
Perfect. That is one of the, how do I want to say that? That's like the minimum you want to set aside in addition to your premium, right? So
Right.
you've got your premium total, and then you've got $68 that you want to set aside. One of the things that is really important too is the rest of this document has some other kind of information. It can tell you how much you might set aside for a flexible spending account, which is a savings program that's offered through your employer to help you set aside money tax-free. And you may not have signed up for that this year, but that's okay. Next year you'll know, right?
Right.
But you can set aside money's tax-free and then use it to cover these out-of-pocket medical costs. The downside of it is if you don't use it, you can lose it. So you want to always estimate as well as possible how much to set aside in that account.
Right.
It also can help you figure out if you're eligible to take a tax deduction on your income tax, or even if you pick the right plan. So this is kind of a cool fact sheet to have. And of course, it's on our website if you ever need to share it with a friend or so. So that's a good thing to know about and use.
Okay, that's great. So then it looks like I really need to keep track of all these documents that I'm getting in my pay stub and my medical receipts. So do you have a good recommendation of how I can organize all that information?
Absolutely. Some things are going to come kind of electronically, right? So you could set up files on your computer and download things electronically and keep them organized that way. I, of course, use the old-fashioned way and have a good old file folder, which I made you a set just in case you want to use them. And there is also, here's a kind of a list of suggested categories, but I keep them organized by plan. So I have a file folder for my health insurance, and I would put my evidence of coverage and benefits in there, and then I have another file folder for the explanation of benefits document. That explanation of benefits document is really something that provides information after you have used a service, and that's an important document to kind of pay attention to.
Yeah, I did have a question about that. So when I get that in the mail, do I need to do anything with that?
Yeah, it's really good to kind of look at it and make sure, A, that it's you that got the service, because there's this terrible thing called medical identity theft where people
Oh, gosh.
I know, steal your health insurance information and then go get care under your name, and they end up billing your health insurance. So the other information on the EOB is going to be how much the provider charged, how much the health insurance provider paid to that provider, and then if you owe anything, right? So another thing to kind of make sure is all of that is correct, and that if you paid, say, a co-payment when you went to the doctor, that may be listed there. And then usually when you go to the doctor, they give you a receipt, right, for whatever that copay is. So that's another piece of paper, right, that you want to keep and also match between your EOB and the receipt, and just make sure it all corresponds correctly.
Right, definitely. Well, thank you so much for these file folders, Aunt Maria, and thank you so much for helping me today. I really feel like I can tackle this health insurance stuff now.
I think you can, and I'm so proud of you for being proactive about this. So I think it's time for a cookie.